So your sweet little baby may be a little extra cranky these days as he or she are experiencing teething symptoms. But what can a mom or dad do? Well, here are some helpful tips. Tip 1, use a clean finger or damp washcloth to massage your baby's gums as the pressure can help ease their discomfort. Tip 2, offer a firm rubber teething ring rather than a liquid-filled one that may break under the pressure of your baby's chewing. If a bottle seems to do the trick, use water because prolonged contact from sugar from the formula, milk or juice, may cause tooth decay. Tip 3, apply a cold washcloth or chilled teether, but don't use anything frozen because the extreme cold may hurt tender gums, doing more harm than good. Tip 4, prevent skin irritation from excessive drooling. Keep a clean cloth handy to dry your baby's chin. Apply a little calendula cream and make sure your baby sleeps on an absorbent sheet. And tip 5, use Boiron Camilia liquid doses to help relieve painful gums and irritability, as well as some minor digestive disorders, sometimes associated with teething. The sterile single-use liquid doses are easy to administer and there's no risk from numbing your baby's gag reflex, which can interfere with nursing. And Camilia is also free of benzocaine sugar and preservatives. And lastly, schedule your baby's first dental visit by age 1 or within 6 months of the first tooth appearing. Early oral care will ensure a lifetime of healthy teeth and gums.